You know the sound. It's 3 a.m., the house is completely silent, and then it starts. That relentless, sometimes really heartbreaking meow from your cat that just won't stop. If you're losing sleep and just wondering what on earth is going on, you have come to the right place.
Okay, so let's get into it. That nighttime crying, it's not just your cat trying to be annoying. I want you to think of yourself as a feline detective. That meow is a message, it's a clue, and we're gonna put on our detective hats and figure out exactly what mystery it's trying to solve.
Welcome to Pets Fun Zone, where pet lovers find quick tips and some really fun facts. In this explainer, we're going deep, investigating the most common medical reasons behind your cat's little midnight concerts. And we're gonna start with the most important question: what's normal and what's actually a cry for help? So first things first, we gotta know the difference. Look, all cats meow, right? You get those short little bursts when they want food or that cute chirp during playtime. That is totally normal cat language. But what we're talking about today is something completely different. We're talking about persistent, loud, unusual yowling that feels totally out of character. And here's the biggest clue. If you have an adult or senior cat and this behavior is new, that's our first major sign that something more is going on. Our investigation is going to start with our older feline friends because, well, age can bring some very specific clues to the table. When we're talking about middle-aged and senior cats, there are two prime suspects that pop up again and again when it comes to excessive meowing. The first potential culprit is a condition called hyperthyroidism. Now, to put it simply, this just means your cat's thyroid gland has gone into overdrive. It's like their internal engine is stuck in high gear, pumping out way too much hormone. This speeds up their entire metabolism, making them feel restless and agitated, especially when the house is quiet at night. And here are the key pieces of evidence you need to look for. Is your cat eating you out of house and home, but somehow still losing weight? Are they suddenly acting hyper, almost like a kitten again, even in their golden years? Well, along with that loud meowing, these are classic signs. You also want to watch for increased thirst and urination. Their body is just working overtime, and they can't settle down, which leads to those desperate nighttime cries. So if you're suspecting this is the culprit, the plan is actually pretty straightforward. First up, a simple blood test at your vet's office can confirm it. From there, you can talk about the different treatment options. It could be a daily medication, radioactive iodine therapy, or even surgery. The best part is, this is a very manageable condition once it's diagnosed. All right, our second prime suspect is something that affects a cat's mind: feline cognitive dysfunction. You can think of it as being very similar to Alzheimer's disease in humans. As our cats get older, their brains age too, and this can unfortunately lead to some serious confusion and anxiety. The symptoms here are less about physical energy and more about their mental state. The classic sign is something called night calling. It's this loud, mournful yowl that just sounds lost. You might see them wandering the house aimlessly, maybe getting stuck in corners, or even forgetting where their litter box is. Their entire internal clock can get flipped upside down, which means they're wide awake and totally disoriented while you're trying to sleep. Now, managing this is all about providing comfort and stability. Simple things like adding a few night lights around the house can make a huge difference in reducing their confusion in the dark. Keeping a really strict, consistent routine for feeding and bedtime helps them feel secure. You could also try some calming pheromone diffusers and definitely talk to your vet about special diets or supplements that can support their cognitive health. Let's just pause on this for a second. I mean, imagine waking up in a place that should be familiar, but you don't recognize it. That's what your cat might be feeling. Their cries aren't to annoy you. They're calling out for reassurance because they literally feel lost in their own home. Okay, so if it's not age-related, our investigation needs to look into something cats are notoriously good at: hiding pain. I'm telling you, they are absolute masters of disguise when it comes to discomfort. But when the house goes dark and all the distractions fade away, that hidden pain can really come to the surface, and they express it by, you guessed it, meowing. So, what could be hurting? Well, for older cats, arthritis is incredibly common. Their joints ache, and it's just hard to find a comfortable position to sleep in. Another major culprit is dental disease. A painful toothache can make anyone restless and irritable, right? And of course, other injuries or illnesses can cause that nagging discomfort that just gets more noticeable at night. To investigate this lead, a physical exam with your vet is non-negotiable. They can check for joint stiffness and get a good look inside your cat's mouth. At home, you need to keep an eye out for other subtle signs. Like, are they reluctant to jump up on things anymore? Do you see a slight limp? Are they hiding more than usual? If pain is the problem, your vet can provide some excellent pain management options to make your cat comfortable again. All right, our investigation is now taking us even deeper, right into the body's internal systems. And I know this can feel a little overwhelming with all the medical terms, but don't worry. Here at Pets Fun Zone, we believe that just understanding these signs is the first, most powerful step you can take to helping your little friend. So let's look at what their body might be trying to tell you. Two conditions that often go hand in hand are chronic kidney disease and hypertension, which is just high blood pressure. See, when a cat's kidneys aren't working so well, nasty toxins can build up in their bloodstream, making them feel nauseous and just generally unwell. Then, high blood pressure on top of that can cause headaches, dizziness, and disorientation. This physical distress often results in these sudden, loud, and seemingly random yells. The action plan here, again, starts with your vet. Blood work and a urinalysis can check their kidney function, and a simple blood pressure check can detect hypertension. The good news is these conditions are typically managed long-term with prescription diets and daily medications, which can dramatically improve your cat's quality of life and hopefully quiet down that distress meowing. And of course, our list of suspects doesn't end there. While they might be a bit less common, things like neurological issues, developing blindness or deafness, which can be really scary for a cat, painful urinary tract infections, or even heart disease and diabetes can all lead to restlessness and that nighttime vocalization. Wow, okay. We have gathered a lot of evidence, and we've identified several potential culprits. So now let's pull it all together into a concrete action plan. This is what you, the feline detective, need to do to finally solve this case and help your cat. So here's the crucial part, knowing when to act fast. Think of this as your red flag checklist. If you see any of these signs, especially rapid weight changes, a sudden big increase in thirst, or any new confusion, do not wait. These symptoms mean you should call your veterinarian immediately. Early intervention is absolutely key. Now, while you're waiting for that vet appointment, there are things you can do at home right now to provide some comfort. Keeping a consistent routine for feeding and playing helps them feel secure. Making sure they get plenty of playtime during the day can help them sleep better at night. And honestly, sometimes just offering a warm, cozy bed in your room can give them the reassurance they might be crying out for. We're getting close to the end of our investigation. We've examined all the evidence, we've outlined a plan. Now it's time to decode that final message and make sure we don't fall into some really common traps along the way. Finally, it is so important to avoid a few common mistakes here. The absolute biggest one is assuming it's just bad behavior and trying to ignore it. The consequence of that? A treatable medical issue goes undiagnosed and your cat just continues to suffer. Another huge mistake is punishing the cat for meowing. This will only make them more anxious and stressed, which makes the problem worse. Remember, they are not doing this to spite you. They are communicating distress. So if you take only one thing away from this whole explainer, please let it be this: that persistent, unusual nighttime meowing is not something to just ignore. It is very, very often a direct signal, a red flag, that your cat is dealing with an underlying medical problem that needs a veterinarian's expertise. So remember, a meow is a message, and when it comes late at night, again and again, your cat is very likely asking for your help. By playing detective and taking action, you can be the hero they need. Join the Pets Fun Zone community for more pet facts and tips. Go ahead and subscribe, check out our blog, and shop our pet lover gifts. All of those links are waiting for you right below.